So just a bit of background initially. So we know that the Modernising Scientific Careers is a UK-wide programme. It was established initially in 2008 and was developed to ensure the education and training of the healthcare science workforce was harmonious, as well as being both consistent and coherent across the different scientific specialisms, which obviously in the previous talk show there are many. The MSc programme ensures that the healthcare science workforce will be fit to respond to future scientific and technological advances and to meet the demographic, epidemiological and financial challenges facing the health and social care system. Looking through the literature of the Modernising Scientific Careers, there are certain key elements that are outlined. These include standardised training and education pathways and curricula with defined learning outcomes and competencies. So background prior to the STP, so there's quite a diverse cohort of trainees that enter the programme. So they may have come straight from university with a BSc and come into the STP training. They may have a BSc and or MSc and PhD, or they may have gone to university and actually worked in academia or industry or in the actual healthcare setting before actually applying for the scientific training programme. Therefore, the scheme does have a very diverse intake. For me personally, prior to starting the STP in clinical biochemistry, I had a BSc in medical biochemistry and a PhD in epigenetic reprogramming. I also worked in academia and industry for a time. Very briefly, now, as mentioned, I work at Sandwell West Birmingham Hospital's NHS Trust. I started working there in September of last year as a clinical scientist and applied for a principal clinical scientist role, which I was offered. So I now oversee one of the specialist sections there. So very much my day-to-day kind of responsibilities, in addition to kind of my duty biochemist role, obviously is managing the specialist section, which is the lab here, service development and procurement aspects, to name a few. So back to the actual purpose of the talk, my STP experience, how did I find my training? So I've broken it down to each individual year. So in year one, for me, it was very much kind of getting to grips with my new career pathway that I've chosen. Year one was with the OLAT and the many competencies on OLAT, which are obviously linked to your learning outcomes. And these have to be signed off by your training officer or your reviewer, your assessor, once satisfactory evidence of your competency has been provided. Now, for evidence, you have to provide examples of how the knowledge and skills that you have applied in the practical setting. So for me, this consisted of writing a summary review using kind of the competency and knowledge and understanding aspects, which is applied on our OLAT, which I'll show you on the next slide. I have witness statements. So if I was performing the maintenance on an analyzer, for example, the assessor who was watching me do it kind of did a witness statement for me. Reflective statements, so anything that I did I reflected on. Results that I processed, obviously keeping them anonymised. Case presentations, whether it be for case-based discussions, or we had weekly duty biochemist meetings where I present cases there, and obviously that's all evidence that you can use for your competencies. And any audits that I performed, clinical or laboratory audits, all kind of aided with evidence for the competencies. Questions that I was sometimes asked by my assessors is what is competent and what is acceptable, satisfactory evidence. So for me, when people were asking me what is competent, they would say, well, obviously you're training to be a clinical scientist, so you can't say you're competent as a clinical scientist because you're not one of those yet. And as for a BMS, obviously if you're in a specialised section for say a month and you're learning different methods, you may not necessarily be performing them the number of times a BMS would perform them to be signed off as competent. So therefore, you know, what do you define as competent? And for me, I kind of looked at it for the time frame that I had in that section performing that method. Had I kind of understood the skills and the knowledge of the method to answer kind of the questions when I was being assessed for the time frame that I had for that particular assay, for example. What is required in your competency? So what is satisfactory evidence? I think personally, talking to my fellow friends, other trainees, I think this varies quite a lot depending on your supervisor, the person who's assessing you. Some of my friends were able to upload, say, some results or the Levi Jennings plot as evidence, and they got that accepted. For me, I had to write a summary review and kind of prove that I had the competency. So I think there's quite a lot of variation there. So for example, this is an example of one of the competencies. So you have your competency here, so perform the analysis to X, Y, Z here, and then your knowledge and understanding. So for some trainees, they kind of showed that they've done this, uploaded it, and it was signed off. Now, I'm assuming that they would have proven this by other means, but not necessarily have uploaded that onto OLAT as evidence. So I think there's quite a bit of variation there. So I think considering the modernising scientific careers kind of key elements of standardised training and thinking of satisfactory evidence, I think perhaps more guidance is required here, or perhaps kind of to ensure that trainees are uploading kind of the equivalent evidence to each other. So, in years 2 and 3, you have to do 2 case-based discussions per module, but obviously you're actually preparing 4 because you're submitting 2 for each one. Direct observation of practical skills. It kind of depends what DOPS assessment you're doing for your module. So sometimes I would be assessed by my assessor doing a horizontal audit, and then he uploaded that and then assessed me with the slidey toolbar. Sometimes I would also do competency assessments, kind of using the BMS assessments, and do witness statements. I don't know whether it's changed, but I wasn't able to upload any evidence myself. It had to be my assessor to upload the evidence for the DOPS, and sometimes it would have been nice if I was able to actually upload evidence too, because obviously anything you do, you can use for evidence for your other competencies as well. Similarly for observed clinical events, kind of obviously again you're being assessed by the slidey toolbar, but I kind of did reflective logs on anything that I did, a witness statement, so whether it be kind of phoning and discussing abnormal results or going to point of care clinics to see glucose tolerance tests, and again anything I did there I could use for evidence from my other competencies. Obviously you have your MSc in clinical science, which is part-time, and in accordance to the national score they recommend that 80% of your time is spent on work-based training and 20% of your time is on academic work. So 1 day a week we had like our study day. My university MSc was done actually at Nottingham. Nottingham don't actually do the course now, I believe it's Birmingham and Manchester. But for me, I had distance learning where I had to download the lectures and then listen to the lectures on my study day. But I believe with Birmingham and Manchester, you have study blocks now where you get your lectures. So on my study day, it was very much listening to lectures, any coursework I had to do. Obviously, when you're doing your project, you're using that time there for writing up your project, and also competencies. Because obviously, for me, with my training anyway, obviously I'm in the lab, I'm learning, I'm working, and I'm expected to be in the lab, because obviously that's where you're going to learn the most. So therefore, to write up your competencies, you know, it was very much done on my own time or on a study day. The MSc and the clinical laboratory experience, for me, I found complemented each other very well. It aided with my understanding, and the tutorials that I received at Nottingham and at Derby very much helped my understanding and learnings. So in year 2, you're obviously going into your specialism area. So for me, it was clinical biochemistry. Now, there's been kind of talk about the advantages and disadvantages. Obviously, with the new training, it's 3 years, and you don't specialise until year 2, so you only actually have 2 years in your chosen specialism area. The recent interview by Dr. Mike Thomas, who's actually going to speak next, states that he accepts that the new scheme cannot compare to the previous 4 years training in a single discipline, but sees a new programme as better equipping those who want to ultimately become a pathology director. So in year 2, obviously you're kind of getting to grips in the nitty-gritty of your chosen specialism area, you're continuing your competencies, your work-based learning, and you also have to consider about your elective experience. So the aim of your elective experience is to facilitate a wider experience of healthcare and or practice of healthcare science in a cultural and or clinical setting that is different from your usual training environment. It may involve healthcare or healthcare science in a different area to the health service, or you may be able to pursue a particular clinical or research interest. The National School states that the host department should agree the timing and the content of your elective training period with the trainee, but it is important that the trainee is able to express their preferences for the electives and for these to be taken into consideration. So when you're kind of considering your elective, do you stay local, do you go national, do you go internationally? Now, the National School kind of gives some examples of what you can do for your elective experience. So they give examples of you could go to Europe, you could go to North America, experience advanced healthcare systems or healthcare in a developing country. Or you can experience a different clinical setting more locally, for example in vascular surgery. So for me, I explored unfamiliar territory locally, so I obtained an overview of areas outside clinical chemistry, including those with direct patient contact. So I went to neurophysiology, vascular surgery, microbiology and bowel cancer screening. So this allowed me to gain a wider understanding and knowledge of the healthcare scientists in other disciplines. It allowed me to actually interact and engage with patients more, and understanding how each area integrates with clinical chemistry to provide a high quality patient care and the necessity of an integrated approach. You also have the chance to present your elective experience at the ACB STP elective day, and obviously that allows you to complete a competency as well. I do know some trainees have gone abroad, and I think if you do go abroad there's lots to consider, especially in terms of funding and insurance, so it's quite a complex aspect to do, and if you're going to do that I think you need to plan early. Another big aspect in year 2 is your MSc project. So at Nottingham there are many kind of different projects within the department and different ideas, and obviously your project allows you to develop your skills and your knowledge, and obviously ideally improve the service of the hospital, the department that you're actually in. For me, when I was kind of choosing my project, I was speaking to one of the principal scientists, and they gave me a few things to consider for my project which I found very useful. So they told me to consider about equipment access. It might sound very obvious, but you may have a project and it sounds absolutely fantastic, but it's on a specific piece of equipment. There's only one in the department, and perhaps it's used very frequently for running patient samples. Will you have enough access to the equipment to complete your project? Now, it might be if everything goes smoothly, as according. So if your project does require ethics, it's something you need to apply for early. Reagents, samples. Do you need special reagents? Do you need special vials? Patient samples? Do you need to start kind of storing patient samples or collecting EQA materials? How will they be stored? Will they be stable? These are all things to kind of consider early on, so when you actually start your project you can just get on and do it. It may be obvious as well, but be organised. Write up as you go along. Write your introduction as soon as possible. As you collect your results, do your figures, do your tables, write your methods as you go along, because in the long run it will be a lot easier for you. So in year 3 is probably on the stressometer, things kind of notch up a little gear. There may have been the occasional time I may have looked like this, but not all the time, I have to say. But basically, you're continuing on with your work-based learning, you're continuing on with your competencies, and you have to submit them all by the August deadline. You have your final MSc, so in toxicology, nutrition, and pregnancy and PE, so you have the final exams. You have to finish your project, write it up, submit it, have your viva. You have obviously the important OSFA assessment, your objective structured final assessment, which is normally in July of your final year. And obviously this is the tool for assessing practical skills that you are expected to have mastered and underpinned by your scientific knowledge prior to registration as a clinical scientist. Obviously it's in 2 parts, your generic and your specialism. It's normally the start of July and you get your results the middle of August. I can't go into too much details about the OSFA, but you are offered a mock OSFA in the February of your final year, and I would say to any STP trainee to do the mock OSFA, because it does give you a good insight to what to expect for the real thing, and it's not as scary as you think. And obviously you have to find a job. HCP registration, I just thought I'd mention this. So if everything goes according to plan with the training, you have your completion of the STP programme by the end of September, and that's when you're able to apply for your registration. I applied for mine as soon as I was able to, and I got my registration number mid-November, so that's around about when you'll be registered. So, in summary, for me, my STP experience was challenging, it was rewarding, it was stressful at times, diverse, interesting, but very enjoyable, and I'm very pleased with doing the STP training programme, and I enjoy my job that I do now. Top tips for STP trainees. I would say be organised and aware of your future competencies, DOPS assessments. You may perform certain methods earlier in your training which you can use as evidence for your competencies. It may allow you to complete certain competencies sooner. So that leads me on to my next point, which is keep on top of your OMAT work. Don't allow them to build up, especially if you have to provide quite a lot of evidence for your competencies. Just don't allow them to build up. Aim to have your first year ones complete in your first year, your second year in your second year. Grab opportunities, be involved. So if there's any procedures that you know is going to occur, ask if you can see them. In my first year, I heard about an adrenal vein sampling, and I asked if I could go and see that, and I was allowed to. And it really helped my understanding about that procedure. Attending clinics, I went to a lipid clinic, I went to a bone clinic, point of care clinics, and be involved with audits. You might get publications out of them or posters and present at Focus. Apply for jobs early. You may not feel necessarily kind of ready at the start of your third year to kind of apply for jobs, especially when you've only been in your specialism area for like 1 year. But if you get offered a job, it's fantastic. And if you don't, it's good preparation for your actual offer. And sometimes you just need to remember to take time out for yourself. Sometimes things can be a little bit overwhelming, and sometimes you need to just take a step back, take 5 minutes, reassess, and then crack on. So summary of key points. Probably the main one is the OLAT assessments. Are they sufficiently standardised if you're considering kind of satisfactory evidence? I think this is something that perhaps could be addressed to make it a bit more equal for all trainees in different hospitals. For me personally, having my training at Nottingham with the competencies and my MSc, I found that the STP was fit for purpose. Obviously when I started my new job, obviously it was nerve-wracking, it was a new job and you're applying kind of everything that you've learnt, but I felt like it did give me a good grounding, a good basis for me to go forward, and obviously you're still learning as you're going along. The next steps for trainees, the next steps for me included, is for me personally obviously developing in my new role, build on scientific and my clinical experience. Obviously I'm overseeing one of the specialist sections now, so managing that section, developing the service, obviously procurement, continuous professional development, obviously my formal training, FRC path parts 1 and 2, and obviously consideration of the higher scientist specialist training. That's why they say HSST. Obviously that's going to be on the next talk. This is a 5-year training. Once you've done the training, you're on the register to be able to apply for consultant posts. I believe there is the equivalence as well that you can do, so you can apply for consultant posts. So these are kind of things for me to consider kind of going forward. So I'd just like to thank Rachel and ACB for inviting me to talk today, and thank Nottingham University, and especially Dr. Stephanie Barber and Dr. Donna Fullerton, who were my supervisors during my training, and also the staff at Sandwell and West Birmingham, especially Professor Jonathan Bird, Dr. Nicola Barlow and Dr. Jenna Warden for their support since I've started working there. Thank you.